What's up, guys? I'm Westin. I'm a nursing student, and this is my patient today.
I can that. I'm also a nursing student.
Alright, so first I'm going to walk into the room. My hands are going to be washed. I'm going to do 2 patient identifiers. So I'm going to ask her for her name and her date of birth. And then I'm going to explain what we're going to be doing today. And then after that, I'm going to look at her posture. Patient is upright. Her hygiene, she's well cleansed. She looks healthy. And yeah, so yeah, she looks healthy in her hygiene. She looks clean as well. And then she looks somewhat calm and collected. She's giggling right now, a little tired maybe. And then after that, I'm gonna assess the level of consciousness. So why are we here today?
To get a head to toe checkup.
All right, name.
Catherine McMillan.
Date of birth.
12/27/2001.
What time is it?
It is about 11 o'clock.
Right. So patient's speech is very articulate. And then are you in any pain?
No pain.
Right. Patient has a pain level of 0. So now what I'm going to do is I'm going to take the radial pulse, and I'm going to count for 30 seconds, starting now. Right, coming in 34 and 30 seconds, 34 times 2, 68. Normal ranges are within 60 to 100, so she's within normal limits. So after I checked her pulse, now what I'm going to do is I am going to count her respiratory rate, so I'm going to put this back up. And her chest is moving in and out about 1 to 2 centimeters. No, she's not using any trapezius or any accessory muscles to breathe, as I can see. So now I'm just gonna count for 30 seconds. As it looks starting now. Alright, so I counted 9 breaths, which is 18. Normal limits is 12 to 20, so she is within normal ranges. So now what I'm gonna do is I'm gonna take Catherine's blood pressure. So about 80% of the width of the blood pressure cuff is going to be the determinant of the size, as well as 40% the width of the bladder. So let's see. Give me assistance. I have the artery mark. Right, patient's blood pressure is 110/70. So that's within normal ranges because systolic can be 90 to 120, and diastolic can be 60 to 80. So now after taking Katie's blood pressure, I'm going to assess her face. So Katie, have you puff out your cheeks, smile, raise your eyebrows, frown. So I do not see any dysymmetry. Everything is symmetrical. So now I'm gonna look. Her eyes are symmetrical. Nose is midline. Her lips are midline. Corner eyes line up with the ears. Face is symmetrical. So now I am going to check Perla. So I'm gonna do direct lighting. So right, check this side. So pupils constrict evenly. So now what I'm gonna do is I'm gonna check indirect lighting. So alright, pupils are equal, round, reactive to light, and now I'm gonna check accommodation. So I'll go ahead and follow this in, starting out 12 inches. Right. As I get closer, her eyes lie inward, good sign of eye strength. And now what I'm going to do is I'm going to move on to Catherine's arms, and I'm going to inspect that. So first I'm going to palpate around the joints and the wrists, the hands. Do you feel any pain as I'm doing this?
No.
You feel any pain there either?
Nope.
Great. So, and then the way I'm gonna look at the symmetry. So symmetry is equal bilaterally, and then skin tone tan with pink undertones, and then I'm going to check for edema. Right. I'm not noticing any pitting in each arm. Okay, I'm gonna check the temperature. Right, I got cooler as I went down towards the hands, which is a regular finding. Now I'm going to move on to Catherine's chest, thoracic area, and I'm going to start above the clavicle, making sure to avoid bony areas, going along with the patient's breath. All right, I'm gonna add mid axillary. All right, lungs sounded clear. I did not hear any crackling. And by the way, I just want to inspect her chest. I forgot to note that there are not any lesions, and yeah, nothing visually appealing. So now I'm gonna come to the posterior side. And I do once again, also tape. Make sure to avoid bony areas. Bend forward real quick. And then I'm gonna end mid-axillary. Okay, once again, no crackling, lungs sound clear. Now I'm going to check different regions of the heart. So I'm gonna go to the second intercostal, right here. This is the aortic region, right of the sternal border. Okay. Same on this side, 2 down, intercostal space, left of the sternal border. This is a pulmonic region. This is the aortic region. Right, and then 3rd down. This is Erb's point where you can hear murmurs. Right, and then 4th intercostal down is these are all left of the sternal border. And this is the tricuspid region. And then 5th is midclavicular, and this is considered the mitral region. Okay. Right, so I heard S1 and S2 noises. No murmurs noted. And now that we're done with that part, I'm going to have you lie down for me. Right. So we're going to cover patient's lower half and upper half. And exposing abdomen, all 4 quadrants. So I'm going to first inspect the abdomen. Abdomen is tan, pink undertones, similar to our arms. Symmetrical. I don't see any lesions. I'm not noting any lesions. And now I'm going to auscultate. Do you have any pain today?
No.
Alright, if Catherine did have pain, say in her lower left, I would start clockwise in the lower right. So today, let's start in the lower right area. I'm going to auscultate 2 locations on each. Right, so regular bowel noises. I heard gurgling, so that's a good sign. Catherine must be having good bowel movements. And now what I'm going to do is I'm going to palpate the 4 different quadrants. So are you having any pain as I'm doing this?
No.
Right, I'm not noting any distension, no bloating, no abnormalities that are of concern in terms of like just overall just internal distension. So now that I inspected her abdominal region, I am going to cover her upper half. She's comfortable. Feeling her legs. So first I'm gonna inspect both legs. So legs, in terms of length, they are equal bilaterally, and the color, tan with pink undertones, darker towards the knee area. Freshly shaved legs, no hair anywhere. And then I'm gonna look for any lesions. There are several secondary lesions in the form of scars. I'm gonna note this one. This one is the size of a penny, and it is on the right knee, left of the kneecap, right of the kneecap. and the location it's just singular by itself. Now what I'm going to do is I am going to palpate around to assess for any pain in the joints. Do you have any pain?
No.
Alright, any pain noted there either?
Nope.
Alright, now I'm gonna check for edema. And while I'm doing this, I'm checking for pitting. Alright, no pitting noted, no edema noted. So now after doing that, I'm going to check the temperature and moisture. So as I'm going down, it's getting cooler, which is regular finding. So now what I'm going to do next is I'm going to check the dorsey and the dorsiflexion and plantar flexion. So I'm gonna check the plantar flexion first. Go ahead and push down like gas pedal as hard as you can. All right, strength is equal bilaterally. All right, now dorsiflexion, pull your toes up as hard as you can. All right, strength is equal bilaterally as well. I'm gonna check feet for decubitus between the toes. No signs of decubitus as of yet. We're good to go there. And I want to ask her, have you been experiencing any numbness or tingling in the legs? Okay, so no neuropathic findings. And there's no spiring of the veins, so I'm not worried about any vascular lesions. So now I'm going to check the dorsalis pedis pulses. Okay, strength is +2 elastic and equal bilaterally. And then I'm going to check the posterior tibial pulse. Again, these are equal bilaterally. And so now I'm gonna put the blanket back down, check for any IVs, oxygen tubes and whatnot, which there are no findings for that. And to conclude everything, I'm going to comfort Catherine, bed to the lowest position, call light within reach, provide privacy if needed, side rails up ×2, and document my findings. That, ladies and gentlemen, is the end of my assessment.